my name is Brianna Eslick, and I am here doing the cardiovascular and respiratory assessment for nursing 383. First, I walk into the room and do some hand hygiene, and then I introduce myself to the patient. My name is Brianna. Hi. And then I'm going to do a general inspection of her chest movement when she is breathing. Everything is symmetrical. Her rate is normal, and her effort, there's no retractions at all in her lungs, so that is good. And then I'm going to move to the back here, and I'm going to begin by palpating from side to side, starting above the scapula, and I'm going to palpate from left to right and compare the sides here. And then go down and make sure there's no tenderness or deformities at all, and go side to side. And then I'm going to percuss, and I'm going to do it the same order, side to side, starting above the scapula here, from left to right. And we're just listening to see if there are any sounds that it makes that are abnormal. I'm going to do the sides here too. And then I'm going to be auscultating her lung fields with using my stethoscope, using the diaphragm of the stethoscope. I'm going to start again in the same spot above the scapula here and compare side to side. And up here, I will be listening to bronchial vesicular sounds, and then continue to listen through the bases, and you will hear vesicular sounds throughout the rest of the lung fields, and then get the sides too. Okay? Then I'm going to come back around to the front, and I'm going to palpate again in the front. I'm going to palpate above the clavicles here, from side to side. Make sure there's no tenderness, and comparing the sides there. And then I'm going to percuss again, starting above the clavicles, comparing each side. Everything is good there with sounds. And then I'm going to listen again to her lung sounds using the diaphragm of my stethoscope. I'm going to start above the clavicles and listen, comparing side to side. And up here I will be hearing bronchiovesicular. And down here on the chest I will be hearing and comparing on each side the bronchial sounds. And then down below I will be hearing vesicular sounds in the base of the lungs. So that is it for the respiratory assessment. I'm going to move on to the cardiovascular assessment, and I'm going to be inspecting her carotid arteries here and for any palpitations, but then I'm going to feel and palpate her carotid arteries one at a time. You don't want to do both at the same time because that could cause them to faint. And then I'm going to again look for palpitations on her apical pulse on her chest, and then I'm going to feel that palpate. Feel that there. And then I'm going to listen, and I'm going to first feel the bases here. First, if I go this way, I can feel the base of her heart, and if I go this way, I can feel the apex. Then I will listen using the stethoscope. I will be listening with the bell of the stethoscope here. First, I will hear the aortic region, and then I will hear the pulmonic region, then the tricuspid, and then the mitral. If I were listening for murmurs, I would use the diaphragm of the stethoscope. And when I'm listening to her heart sounds, I would have her, as she is right now, sitting up and then leaning forward, and also on left lateral side. And that is it for the inspection for cardiovascular and respiratory, and then I will wash my hands and leave the room. Thank you.